Hi, I'm Joanne Ontiveros and I'm a pediatric physical therapist at Ventura County Medical Center. I'm going to be talking to you about a very widespread kind of issue that's happening in the community, and it has to do with a lot of times now we normally must position a baby back to sleep, which means the baby is on their back the majority of the time during the nighttime and sometimes as well during the day. What usually can happen is often a baby will become visually stimulated to one side because there's more activity going on over here, and they will start to favor one side. What happens really quickly is if a baby starts to sleep in one position, and I would say about 80% of the time it is to the right side, there will become flattening and misshapen mess of the head. So in this position, she is looking a majority of the time to the right. So what will happen is the whole right side of the head will become flattened. And when you look at the relationship between the eye over to the temples and the ear, you'll see a flattening straight back to the right, and you'll see a rounding to the left. So in this case, what can happen also is that a baby can end up with what we call right torticollis or right plagiocephaly. Plagiocephaly means flattening of the head. The very first thing that you want to do if you have a baby that is got this issue where there's flattening to one side, you definitely need to encourage the baby to look to the other side. So the very first thing that you can do is try to change the position of the baby, and if the baby has a majority to the right, you're going to really try to move the baby's head often to the left. The other thing that you can do, especially during the day, is that you can give the baby some visual stimulation over to the left side. So during the day, and this baby unfortunately is asleep right now, but during the day, you would start to give the baby more stimulation over to the other side. The other thing that can be done, especially during the day when you're able to position the baby in various positions, is you can gently even rotate the baby all the way to that left side and have the baby sleep a little bit more to the left side if you're there observing. One of the things that we do as well is if you happen to have a boppy pillow, you can start positioning the baby during the day onto the left side with a little bit of visual stim onto the left side. So the problem would be that this side of the head on the right is flattening. So what you're trying to encourage is positioning over to the left, which will help reshape the shape of the head. The other thing that some parents find with the boppy, and never leave a baby unattended, especially above ground like this. You always want to be there. You could easily put this on the floor or the carpet. If your baby tends to move because your baby is a little more active, you can also support the baby in deflection in this position. So you're encouraging left side. So left side, left visual stim onto the left side so that the head will start reshaping. The other thing that will happen is if a baby has, for instance, a right-sided preference. Oftentimes parents may or may not notice that when they sit the baby up, the baby's looking mostly to the right side. The other thing why this is so common is because many of us are right-handed, and so we have the baby in this position, which means that I'm always talking to the baby on the right side. One of the really easy ways to change this is to reposition yourself so that you can put the bottle in the middle, or if you're really going to try it, you can actually switch arms and go ahead and use your left hand to feed the baby. So in this position, the baby would have to be looking towards me to the left. And I would take the bottle and actually move the bottle over to the left side. Baby's going to move where the bottle goes. If a baby has a very right flattened head, you're going to want to keep visually stimulating to the left side. Oftentimes, what will happen is a baby will very, very quickly have a right visual dominance, which means that if I'm like this for majority of the time, I'm also only looking at my right hand, and I'm really experimenting and looking, and usually hand-to-mouth occurs mostly on the right. What can end up happening is that a baby will not see this left hand until it is way over in the middle of the field. So they'll be losing some of this visual field to the left. If you have a right preference, your majority going to be over here. You're going to be visually stimulating this whole field. You really want to start trying to visually stimulate the left quadrant. So what you do is you bring a toy up to this side, you visually stimulate the baby to look this way. The older the baby, for instance 3, 4, 5 months old, will be a lot more visually able to stimulate. Really young babies that are only 1 or 2 months are more visually stimulated by faces. So if I have a baby that's bottle fed, and I'm going to grab a bottle. If I have a baby that has a right preference, and I want the baby to not be always looking over towards my right side, I'm going to take the bottle and I'm going to just go ahead and move the bottle all the way to the left side, and basically kind of help the baby along with rotating the neck towards the left. The other thing you can do is when you're sitting down, you can gently keep moving the bottle over and over until you get left rotation. What happens with right torticollis is oftentimes there is decreased left rotation. So if you actively keep rotating during feeding, and that would be at least 5 to 6 to 7 feedings per day, you're going to be doing active rotation to the left. The other thing that's a really good position is when your baby starts to be up and sitting, which can be as early as 3 months. You can start in this position. So I'm cradling the legs and holding the baby in a supported position. I want the head to be in neutral. So what happens is you will actively kind of see if your baby is over to this side. You want to move your baby over so that you're stimulating the baby over to the midline, or even a little bit towards the left. So if you have activities or you have people playing over here, you can start having the baby visually stimulated to the middle and upright. Another thing that can happen with the right torticollis is that you can have a left tilt. So one of the positions that happens, which is can be a congenital torticollis, meaning a baby has a tightening to the left side of the neck, which can include this muscle right here to the left side, and the baby will tilt the head to the left but will rotate towards the right. So this is actually a left torticollis, but the baby's rotated to the right. In this position, the best stretching is to gently get the baby's head back to neutral. So what I'll do is I'll hold the baby in my left arm, I'll get the baby's head with my right hand, and I'll gently pull the head into neutral. So my movement is this way. My movement is going from left to right, and I'm really gently and slowly tilting the head so that it's at neutral. So that's a really common position if you have left torticollis. Left torticollis looks like this. And if you look at the space between the left ear and the left shoulder, you will see diminished space. That's the easiest way to sort of check for the torticollis, is you'll see a decreased space right here. So the goal is to increase that space between the left ear and the left shoulder. So in that way, I'm just real gently opening it up so that I'm opening the space between that left ear and that left shoulder. So that's a really easy stretch, and if your baby starts getting fussy, You can kind of position this way where you're kind of real actively moving. Babies actually like this position, especially if you're gently moving and rocking. And it's a really easy stretch. You're doing it very, very gentle and just getting the head into neutral. And I'm using my body to actually help me position that head. I'm using my shoulder to help position the head. Now, occasionally you do have the opposite problem. So if the baby had a right torticollis, what that looks like is the baby's head would be tilted towards the right and would be rotated towards the left. So that's considered a right torticollis. A right torticollis means that the space also between the right ear and the right shoulder is diminished. And what usually happens is you have some tightness in the right part of the neck. So with this stretch, we're just doing the opposite. I have the baby in my right arm, and I very gently get my left hand and bring the baby's head to neutral so that I'm increasing the space between the right ear and the right shoulder. And just really, really gently, you stretch very slowly. Everything is very slowly. And these stretches can be done 5-10 minutes for several times a day. The more that you start to stimulate your baby to movement, you will see, hopefully, that your baby will start moving more in different positions, especially when they're on their back and when they're sleeping. If your baby has right torticollis, which means that flattening or that preference to one side, which means the right torticollis means they, if they have right torticollis, the right part of their neck is tight and this part is shortened. So usually they're rotating over towards the left side. If that's the case as well, what you want to do as well is give the baby tummy time. Put them